For decades, Tylenol was advertised as the pain reliever hospitals used most. Today, President Trump told the world it could actually be the pain reliever taken by pregnant women that caused the massive spike in autism rates we've seen in the United States.
Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born.
Today's press conference was admittedly bold and came with the caveat you should probably check with your doctor and have discussions with them. But, and this is the important part, it was a follow-through on the President and RFK's promise to have a report on the causes of autism by the end of September. And as you know, this is personal to me. Last week, I wrote an op-ed in the Wall Street Journal. I'm autistic. RFK Jr. is right to hunt for the root causes. A condition that affects millions of children is too important to become another political football. With us now, Dr. Bhattacharya, director of the National Institutes of Health, former professor at Stanford School of Medicine. Pleasure, sir. As they say in radio, a longtime listener, first-time caller, big fan of your work for a long time. I'm not going to talk to you about the medicine part of this because I think the press conference speaks for itself. People can talk to their doctor. You can do your own research. But this issue of autism, we've gone from 1 in 1,000 or 1 in 2,000 cases when I was a young boy and diagnosed with what we now know to be the condition. Now it's 1 in 36. For boys, it's 1 in 12. Minority boys, it's even higher. It's crazy, the explosion in cases. Why has it been so hard to get, and I'll put it in air quotes, science to take this question seriously?
I mean, I think there's like a couple of things going on here. So first, whenever doctors and scientists don't understand something, especially when doctors don't understand something, we often just treat patients who have it like they don't know what they're talking about, that they don't use, that the condition's not real in some ways. And I mean, I think there's some of that, like there's lots of groups of marginalized patients like that. But also for autism, you know, there's a history of this, people talking about vaccines being connected to autism. And of course, vaccines are a tremendously important part of what doctors have in our portfolio of things we can do to actually keep people healthy. If there is a link, no one wants to talk about it because what if it reduces the demand for vaccines that would keep people healthy? I think those two things have made it so that it's so hard to get an honest conversation because I'm pretty sure that it's probably not going to be vaccines as the cause, but by saying that, I'm acting as if I already know for a fact. In fact, I don't know why the rise in autism has happened. I don't know. I don't have an answer to that. If you asked me to pin down one thing, I wouldn't be able to tell you.
It seems as though when we're watching coverage, and I don't like saying this, but I predicted this last week. I predicted in my op-ed when this report came out, there was going to be far more anger about what might be the causes and saying it's wrong than in the important work to find out what is. This is just some of the doctors from today. Take a listen.
I think it is pretty solid that there is no association with acetaminophen or Tylenol given in pregnancy and autism. This was a dangerously irresponsible thing for President Trump to say when he said, tough it out, because that only puts children at higher risk, especially with fever in the first trimester.
I'm very worried that if we take away the one last option based on really junk science, when there's not evidence to do this, we're going to end up causing more harm than good.
We can't just do this willy-nilly. We have to be serious about it. And frankly, there is no link when you look at the best evidence.
What I am more worried about when I hear that is what my mother used to say to me sometimes, seldom right but never in doubt, in that it reminds me of what we heard about COVID. If you get the vaccine, you cannot get COVID. We are positive. And if you say anything else, you must be wearing a tin hat. You remember, because people did that to you. Why is this now the same thing about any discussion of causes of autism?
I mean, I think, like you just heard it here on those clips, right? They've read the literature, I guess, and they've decided, they made up their minds. I've read the literature also. The dean of the Harvard School of Medicine agrees with me that there is an association. Now, do I know for certain that it's a cause? I don't know, but I agree with President Trump. if you can avoid taking Tylenol in pregnancy, then it's wise to try to avoid it, right? It's just actually it's true for any medicine. You want to be careful with any medicine, but especially when there's a potential link to something you don't want for your child later on, and if it's a low-grade fever, you can manage without it. Then try.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.